the county. However, we are focusing on 2 for our seniors, and that is their Senior Link program. So that is a call-in program to all of our shut-in seniors. And then they also now have a home delivery for shut-in seniors. So that's groceries to those seniors. So with this pandemic, those are the 2 programs that they are needing more assistance with, because now we have more people who are shut in. So I know they still, they're looking for food donations and any money that can help in those areas. And they may need more volunteers for the call-in program, because I believe they only have 2 staff who were doing that program. So they can need any volunteers or anything like that. So I know, like, right now, this is probably what is needed more than anything else. So
perfect timing for them to be out.
Yes, unfortunately it had to be through a pandemic, but it's a great program, and I think now it's needed more than ever.
Thank you, Christy.
Sure.
So I think I'm going to go ahead and chat a little bit. Good morning, everybody. Lauren Perea with Old Dominion Home Care. It's so nice to have you back. I wish I could see all your faces. I miss all of you so much. Right, Rach?
That's what I was thinking.
Isolation is tough for all of us, but we really wanted to reconnect with everybody however we could. And I think we're going to try to keep doing this for a few months. I think we're going to maybe do a poll at some point. Right, Mr. Wizard of Oz, Steve?
Yeah, you know what? I'll put it up right now while you're just chatting to get people's
okay thoughts. Yeah, we'd like to hear what you think about this format. We're such a great group, and we want to try to stay connected, so we want to see how you guys feel about doing this in several different formats. But I wanted to introduce our guest speaker today, Amanda Babineau LaRose. She is the owner of We Care Management, and we are so excited to have her. Old Dominion Home Care has known Amanda and worked closely with her over the years in different roles, and I'm going to let her tell you a little bit about herself, but I did want to just highlight that this is National Mental Health Awareness Month, so I think this is perfect on many levels for us to have this topic today. So I'm hoping, I think she's going to be a real help for not only our seniors, but for all of us, hopefully. So Amanda, take it over.
And before Amanda jumps in there, I'm just going to end the polling, and you'll see that 88% of the membership would like to keep on going with the virtual meetings.
Right.
Great.
There you go.
Whoop, whoop.
So
It's
we'll
pretty
maybe
cool that
see you next month.
You can do a poll that quick, huh?
Yeah.
All right. Okay. Have a great meeting.
Thanks, Steve.
Thank you.
All right. Well, thank you so much for inviting me to speak on this topic. It's such an important one, like you said, Lauren. And a little bit about myself. So I am a licensed clinical social worker. I can provide counseling support, which is not needed. You do not need a doctor's order to start counseling, which is a nice benefit. And over the years, my background has been in continuing care retirement communities, being a social worker and then director of social work at a number of the communities in Northern Virginia. And when I moved out to Loudoun County, I saw that there was such a need for not only care management support, which is another part of We Care Management, but also the counseling services. And so we are providing counseling in our office in Leesburg, also not right now, of course, and then also in a lot of assisted livings and independent livings, private homes, and then now via teletherapy, which I'll talk more about later. So thanks.
Thank you so much for joining us. Amanda, tell us a little, how is social distancing, illness and loss affecting people and their mental health, especially the older people? What are you finding?
Yeah, there's a lot of effects from this, of course, as I'm sure you all can imagine. The biggest thing that is not only seen across the board for adults of all ages, but especially caregivers and the elders themselves, is stress. And stress because of changes to routine, changes in schedule, not being able to do the helpful and healthy things that they were doing previously. And, so with stress, a lot of times there can come anxiety. And with anxiety, we find that a lot of people are having worries. So, worries about, are they going to get sick, or worries about not being able to get out, and when is it going to end? When is all of this going to change? When are we going to get back to a normal? Are we ever going to get back to a normal? So et cetera, right?
Yeah.
And then fears. So fears are a big factor with anxiety, triggering anxiety. And so, some people are fearing that their parents might pass away from this, or that they themselves or their spouses will pass away. So that's really a big difficulty. But then, you go into the depressive symptoms of loneliness. And, a lot of the elders that we work with, we realize how important that social interaction is, even if they're introverts. Everyone needs to be around people and communicating with people. And so that loneliness, it prevents the brain from being stimulated like it usually is. It creates sadness. It's a lot of people are experiencing lack of motivation, and then sometimes even difficulty concentrating. With the elders, we can also see increased forgetfulness because of all of this that's going on. And then changes in the eating habits. So some people are eating less and some people are eating more. Some people are eating more sweets, especially if you're a baker and enjoy baking like me.
Not just the seniors.
Yeah, right. Exactly.
Or maybe I fit into that category.
But another thing that we've been seeing a lot of people about, and is unfortunate, but a part of this situation, not just this situation, but more so now with the COVID pandemic, is grief and loss. And it's not just elders, it's their adult children and staff, the hired professional caregivers. And grief and loss, during times like this especially, it's just affecting everyone, not just the people that are directly affected, but everyone who is also just kind of seeing what's going on. And, it really seems like everyone's being affected by this.
So, Amanda, what do you recommend people do to prevent these symptoms?
Yeah, I think the biggest thing that I and my staff have been talking to people about is structuring your day. And I'm sure you all have heard this and probably tried it, hopefully in some aspect, but structuring your day and maybe making blocks of time. So, in the morning, maybe it's your morning routine until 8 or 9 a.m. And then perhaps you do some sort of brain stimulating activity for an hour or so. Then maybe if it's a nice day, you get outside, then have lunch. And then in the afternoon, maybe you do some sort of remote social interaction. And then, in the evenings, maybe you watch a little television, those type of things. So it's trying to make sure that every day you are not just kind of saying, okay, well, I'm just going to turn the television on and just try to get through today. And I'm not saying that that's a bad thing, but it's not going to help prevent these symptoms. And so some of the things that you heard me highlight in the structure of your day is getting outside as you can. Even on some of the rainy, windy days, I've really tried to bundle up and get outside just to get some fresh air. but also acknowledging the positives. There's so many negative things right now. And so, you know, not just at the end of the day, but throughout the day, trying to change that self-talk that we have and where the thoughts are, you know, and focusing on the positives, which leads me to talking about limiting how much we're reading and watching the news. So, you know, there are some situations where there's positive news, but not much. So I'm not saying don't watch the news, because it's important to be informed, but I encourage people to limit it. So whether it's 30 minutes to an hour or reading one news article, but not kind of obsessing over it, because that's what can trigger that anxiety and fear. But also eating healthy, and then your physical space. So your physical space is really important to keep it organized, keep it tidy, because a lot of that can create difficulty concentrating, feeling overwhelmed, stress, et cetera, et cetera.
Great, thank you.
I just want to say, I have another question, but if anybody has questions, feel free to put them in the, Steve, where do they put questions?
Put questions in the, down at the bottom of your page, there's a little icon that says Q&A. The other thing people can do is they can raise their hand, which under the participants icon. So, and then just a reminder, I'm kind of going through, if you're making a comment and you need to use the drop-down menu that says select all panelists and all attendees. So for questions, and I know Amanda would love to have questions, use the Q&A or raise your hand. Thanks.
Thank you. I totally, the news, I'm someone I have to just do just a little, or I'll like, oh. So if people are experiencing the symptoms that you're talking about here and sharing, or they notice someone who is, what do you recommend that they do?
I think it's so important to be able to speak to someone who is not in your core network. So having a professional who has extensive training and experience in supporting individuals and guiding them through navigating things like this, you know, transitions, changes, depression, stress, anxiety. And, you know, it's not a negative to reach out to someone and get that extra support. And I'm so happy that our society is starting to recognize that, and that they're utilizing counseling services so much more. Now, if you are noticing these symptoms in someone else, especially an elder, it can be difficult to know how to talk to them and encourage them to maybe seek counseling or agree to it. And some of the things that I encourage people to do is to, you know, first of all, that symptom that you're noticing, that complaint that they have, the distressing concern, using that. So a lot of times, for example, someone might say to you, you know, I'm just feeling really down. I'm having a hard time just feeling motivated during the day. So use those words, you know, say to them, you know, I'm so sorry that you're experiencing, you know, this feeling down and feeling like you're not your motivated self. You know, I know of someone, or maybe we could consider, or you could consider talking to someone that could help you through this and just have a different perspective. And the second part is telling them that it can be so helpful to just be able to talk to someone about these things, and that, you know, maybe especially if you're a family member, you're going through these things too, and it might help to have an objective perspective. So especially with elders, it's important to try not to use the word psychologist or therapist, because there is still a little bit of a stigma. But again, it's identifying the difficulty and the concern so that they're still consenting to this. You know, you're not tricking them, you're just explaining and offering the service in a different way.
What about someone?
Wait, excuse me. Hey, we got a question from Sherry Paul Musi. I know I botched it, but okay, great. Sherry's on the line.
Hey, can you hear me all?
Yes.
Yeah.
Oh, hey, Sherry.
Hi, good morning. Thank you for this conversation because I've had some really positive feedback. My company is Personalized Tributes and Toasts. So I know at Arbor we had a family whose mother was in hospice and COVID was, active. And I was able to take the grandchildren's memories. So they emailed me through my website all their favorite memories of grandma. And I was able to put that to verse. And the most special part of it was they were able to read that to her on a Sunday, and she passed away on a Tuesday or a Wednesday.
Wow.
So a part of that, every day giving them something positive to think about. If you have somebody that's in that setting where they've got people out of state or even people locally that can't get into the communities now, I'm happy to coordinate their memories, write that to verse, and then every day or whenever they're feeling low, that's something they can turn to. Some people have framed it, some have just rolled it up like a scroll, and then it's just something they keep by their bed. But I'll put my website here. I think I see people, kind of putting who they are and my telephone number, but I'm happy to write that. And I just think that's a real encouraging way to let them feel loved, let them feel that they're not alone.
Oh, that's great.
Thank you.
Yeah.
You
So
bet.
it's not just about the visual. In that instance, it's a different format of reaching out to people. Sometimes the senior population doesn't relate to doing technology. So I think that's a really another way of thinking about it, Jerry. So thanks for sharing that with me and everybody else. Did you have a question, Paige?
I do. I'm sorry.
No.
A lot of times I think that, and maybe I'm speaking from personal experience with a senior I know well, it's a physical complaint. Always, my back hurts or I have a head, those kind of things. How would you then kind of gear back to like, maybe you could talk to somebody when it's physical?
That's such a good point. Thank you for bringing that up. A lot of times, not just elders, but anyone, really any age, even children, experience physiological symptoms before they recognize the mental health, and or cognitive symptoms. And so, a lot of times when there's physiological distress, it's disruptive to the individual's life. And I would use the same exact approach, and maybe they'll say, well, what can talking to someone do about it? And what we do is we talk to them about different ways of dealing with it, the effects of it. So it's not that we cure the physiological symptoms, but we help them to maybe focus on something else or lessen that distress through, breathing, moving around, stretches, things like that. But, the mind and the body is so connected that counseling very much helps with the physiological symptoms. I'll tell you, I was working with someone who had a pain disorder, a pain syndrome disorder. And because of the level of pain she had, she was unable to walk. And she was experiencing so much fear and anxiety that, it made the physiological symptoms worse. And for any of you who don't know, some of these pain syndromes are actually caused by mental health disorders, which this was the case. Now, I shouldn't say caused, there were a number of things, but it was exacerbated and made worse because of the fear and anxiety. And so that mind-body connectedness is so important. And does that answer your question, Rachel?
Yeah, yes, thank you so much.
Okay.
And I love how you threw in the breathing, because we got a surprise.
We have a question for Amanda from Allegra. Oh boy, and it was in chat, so I may have just lost it. But it was asking about what grief support workbooks do you recommend? Yeah, here it is. Amanda, do you have a suggestion for grief support workbooks from Allegra Jaffe?
You know, there's so many resources out there, and you know, I will answer your question, but I just want to kind of preface it by saying that a lot of times, especially with grief and loss, that it's really helpful to have someone to go through a workbook with you, have a professional to go through it with you, because there's so much stuff that comes up that can be helped through conversation and support, questions, things like that. And it's grief and loss work, I believe, is a lot about the conversation and the storytelling and changing the narratives that we create around grief and loss. So maybe, I don't know if there's a possibility for this, Lauren and Rachel, but I could maybe share via email or something, a list of workbooks or resources that are helpful, because again, there's a number of them. So.
Yeah.
Is that okay?
Yeah, send that, and then I can send a follow-up out.
Okay.
So this isn't one of our official questions, but it just came to mind after your conversation. Amanda, what about medications? I mean, wouldn't they possibly need to be tweaked if someone's showing signs of depression? And would you see that maybe when you're talking to people, or we're seeing it when we're out talking to our people? Do you have any thoughts about that?
Yeah. So part of our training as licensed clinical social workers is to help to manage the medication. So we do not prescribe, we do not change medications. However, we have a good understanding of the mental health, psychiatric medications and the signs that people need an adjustment and or need to start one of them. Or on a positive note, titrating them down or discontinuing them as things improve. So typically, you know, I like to explain it that everyone has a threshold, and everyone experiences life's ups and downs. And so we're below that threshold and we're trying to cope the best that we can. Everyone has coping skills, whether they're positive or negative or somewhere in between. But they help us get through the best that we can in that moment. However, sometimes the physiological changes in the brain are so much that we go above that threshold and our coping skills just aren't working as well as they were or could be. And that's when people are starting to say, you know, I'm trying, nothing I do is working. I just can't get out of this. And so even sometimes with the help of a therapist. And so those are signs that someone would really benefit from a medication introduction or change. And so we provide education about that. And if they don't already have a psychiatrist, encourage them to connect with a psychiatrist, and we can also help with giving referrals. But sometimes right now is, you know, over the past few years, the wait time for psychiatrists is months. And so sometimes in the meantime, we have them see their primary care physician if it's a general depression or anxiety, because they often will feel comfortable prescribing something in the meantime until someone can be seen by a psychiatrist.
Great, thank you. And what about other services, including teletherapy, that you and your colleagues that work with you provide? Can you tell us about those?
Sure. So the teletherapy is something that we've actually been doing all along. We've been offering it, but now it's the only way that we're doing the counseling and care management piece. So teletherapy is via a video session, usually, but with the changes across the nation to be able to make services, health services more accessible, they have allowed for us to be able to also have phone conversations, phone teletherapy sessions. So, you know, typically what we're doing for elders especially is phone teletherapy, because that's what they're most comfortable with. However, that's not always the case. There are a number of older persons that we are also doing teletherapy with. So because we've been doing it for so long, we have a secure video chat system that we use. So we're not using Zoom or anything. It's HIPAA compliant, and it's very simple to set it up. And so sometimes it can be a caregiver, a spouse, or the individual themselves. And it's really nice because, as you can see with these interactions for meetings, to be able to see someone face to face, especially for us counselors, us therapists, we can see facial expressions, sadness in their eyes, tearfulness, stress, if their shoulders are, up and tense. But then it's great for relationship building. So to be able to be face to face and see each other is really, really helpful. So we're very fortunate to have this type of technology. And I'll tell you, again, we're not only supporting the older persons, but a lot of people who are also going through the stress is adult children and caregivers. So some organizations are having us provide group therapy for their staff, and also individual counseling. So we not only accept Medicare, we also accept some private insurances and can help individuals submit for out-of-network benefits if we do not accept their private insurance.
Great, thank you. Steve, are there any more questions?
Yeah, we've got a couple of questions. From Heidi Garvis, can Amanda comment on any Jerry psychiatrist resources?
$1 question.
So I'm assuming that means, and tell me if I'm wrong, and comment in the question, but to be able to have a couple, some names of geriatric psychiatrists, perhaps.
I'm not sure. She wasn't specific,
Okay.
but probably.
Okay. Yeah, so I can include that. Okay, yes. I can include that on the recommendations, on the list of recommendations.
Okay, great.
There was a question in chat that says, but I think you answered it. Do you have suggestions for older adults who do not have computers for Zoom, but are looking for grief support over the phone? And I think you addressed that.
Mm-hmm.
Something comes to mind to me. So we're certainly talking about the senior population and providing support for them. But one of the things you mentioned in your opening statement, Amanda, was providing support for caregivers. And that includes people that are working in the communities. Maybe, and for example, my case, I work with home care aides, and everyone is out there really working so hard and has a lot of stress. Do you have any suggestions of ways to open up conversation? Let's say I was talking to Rachel, she's working in a community. What do you suggest, for example, I say to someone like that, or even maybe one of our caregivers? I know it's kind of a broad statement, but it's there. People are going through a tough time, but they may not feel comfortable. Any thoughts on that?
Yeah, in my experience with working in the continuing care retirement communities, I remember coaching the supervisors on how to have these conversations. And I'll tell you, we got so much feedback from the caregivers themselves on how uncomfortable it felt to talk to their supervisor about the emotions that they were feeling, because they felt like it was wrong. And no matter how someone opens this conversation up for discussion, sometimes it's just personal beliefs and feelings and experiences. Maybe they've had past experiences that have backfired when they've been open with the supervisor. Or maybe it's just their belief system says that they shouldn't be feeling this. And so to answer your question, really the best thing is to have some sort of format to be able to help connect them with an outside person. Whether your organization has, open support groups, and they could be remotely, or one-on-one resources. It's so beneficial to have that outside person, because again, not just for elders and, adults in any situation, but especially for employees. I have so much experience in how that's just a really big barrier. And so I'm sorry, Lauren, to kind of not really answer your question, but I hope that helps.
Well, I think you're reinforcing that someone needs a safe space.
Right.
They may not feel comfortable broadcasting it to a group. For example, we're doing weekly with our agency sort of a Zoom call for all of our caregivers, and we're providing information for them and really trying to show them love and support. But I don't know if that's going to be the right place for them to feel comfortable opening up with us and how they're really feeling. Mm-hmm. Right?
Mm-hmm.
Yeah.
And the other factor in that is if they do bring up some really tough stuff, it's really important to have a licensed professional to be able to know how to guide them and support them, and in that way, and to identify really concerning things. If something, suicidality comes up, for example, sometimes it's not direct. Sometimes they talk about things like hopelessness, that they're giving away things. Those are maybe someone who's not a licensed therapist or a psychologist or doctor might not be able to recognize that as being suicidality.
Okay,
and so
sessions you're referring to, like when you said giving away things, you mean like, here,
personal.
I want you to have my, okay.
Mm-hmm. Mm-hmm. Yeah.
Yeah. I'm sorry, I didn't mean to interrupt. I just wanted to.
No, that's okay. Yeah.
Wow. So much wonderful information. I hope others have gotten something from this, because I sure have.
Yeah, it's great to see all the sharing of resources in chat. Other organizations are kind of jumping in and talking about grief and bereavement services and things of that nature. And just for everybody who's on the call, we'll be sending a transcript of everything that's in chat to you, along with a recording, so that you can reference this later. I know it's hard to keep track of everything. Just listening here in the background to this topic, I think, Amanda, any words of wisdom on, I think one of the big challenges that our clients face on a regular basis is they're not as healthy, and the things that allowed them to have purpose in life are difficult because they're homebound, or they can't drive, or they've got a health condition. Any sort of words of wisdom on things we can do to inspire people to think outside of the box, to kind of redefine their purpose when they get hit with one of these, with poor health?
That's a tricky one. Good question, but it's really hard to give an answer for that, because there's so much that comes into helping someone find or readjust their purpose, because everyone is so different, right? We're all individualized. So, when I'll tell you, I've actually been speaking with a lot of people about this recently, and it's just kind of ironic. It's not necessarily due to the pandemic, but what I do is I start talking with them about, we do kind of like a balance wheel. And so I have this form that I provide them if they can complete something like this, but it's pretty simple and straightforward. And it talks about the different areas of life. So family, finances, health, career, if there's a career there, and people can rate it. And so that's a really good starting point of talking about the different areas or the different roles that we have. For elders specifically, a lot of times I talk with them about the roles, the hats that they wear. And so, and everyone will be able to identify different roles. So sometimes women, especially who have been homemakers, they really focus and can identify this mother role, this maternal role, and struggle to kind of see the other roles that they actually do have. And so, you know, the more that we get to know someone, so encouraging all of you, whether it's family or, you know, caregivers, to be able to really understand the person that you're working with or that you have a relationship with, and to then be able to kind of highlight and almost offer a question of, you know, I wonder if you also have this area, this role of, you know, whether it's friendship or whether it's gardener, or, you know, and again, brings Steve to your point of, well, all of this is changing right now, but if someone was a gardener, it doesn't mean that they can't garden still. It's how to adjust and adapt. And a lot of people, it's hard for them to see that they can do something differently because it's not going to feel the same. But what I try to have them recognize is that it's better than nothing, you know? And so, yes, you're experiencing some loss from that. And so that's a part of the work that we do also is, you know, identifying that it doesn't just have to be the loss of a person, but it can be the loss of the ability to do as you once did.
Mm-hmm. I think that was,
That's great.
Yeah. So Amanda, you guys actually don't need a doctor's order, right? Can't you prescribe if let's say somebody sees someone in their community or they let their family know about it, you can actually write the physician's order or write an order to have services, correct?
You actually don't even need an order for counseling. So anyone can seek out a counselor at any time. What we do is we do an assessment. And so that assessment is covered under insurance. If you have one of the insurances that we work with, or we can help you, like I said, submit for out-of-network insurance benefits. And then from that, we are able to do a diagnosis. And so, you know, our training is based on mental health diagnoses. And so we're able to do that diagnosis, which eliminates the need for a doctor's order. So, you know, we do that diagnosis and then we just continue to support that individual and create a treatment plan, you know, so goals, what they want to work on. We help them to define those goals, and those goals might adjust. You know, a lot of communities right now, we're working with older persons on preventing some of the symptoms that we talked about or addressing them. But once we do get back to a somewhat more normal and can start being social again, we're really going to have to work with these individuals on not continuing to stay isolated and how to reintegrate into the communities.
Yeah. Did you also mention you can accept Medicare, or do you work with Medicare?
Yes. Mm-hmm. Yep. That's one of the main ones that we work with.
Perfect. That's important. Thanks.
Looks like another question for Amanda from E.L. Stolman. Your thoughts about pet and music therapy?
So the alternative therapies are so helpful. We actually also right now have an art facilitator who her background is as an LCSW, so a licensed clinical social worker who can do counseling, but she is doing virtual mindful art classes that you can find on our website for organizations, caregivers, adults of any age. We have a Saturday one coming up on the 23rd. But so that's one aspect. And then, like you said, the pet therapy and the music therapy, it's so important. It's so important. So, you know, finding really creative ways to support the emotional needs. You know, this is why they have, I'm trying to think of the word, I'm drawing a blank right now. The animals, you know, the word shoot. Anyway, therapeutic, you know, animals that they have certifications for and everything. So anyway, I think that whether it's creating a playlist for someone right now, since maybe there's not a lot of music activities going on, where people coming into the community, things like that. And also, you know, I have to say that, and this is kind of a controversial topic, but sometimes for those who have more of the late stage cognitive impairment, some of the realistic stuffed animals can be really, really helpful. I've seen it work wonders, especially for people who had pets their entire lives. And so both of those are very therapeutic.
Yeah, I put in, I'm putting links in the chat. I mentioned that movie, it's on Amazon Prime, Alive Inside, is just phenomenal. It's about music and dementia residents, and it is so touching, and it makes you realize that all you got to do, it's as easy as just asking or finding out through the client's family what music they loved when they were younger, and just putting some headphones on, and it can radically change folks. And I'll put a link in the Hasbro is the one that creates those realistic animals that cats and dogs that you can pet. And my mom's got one, and she absolutely loves it.
Yeah.
Emotional support animals. That's what
Thank you.
Okay. Thank you, Elizabeth Mako.
Thank you. Are there any other questions anyone has for Amanda? This has been so great. Thank you so much.
Yeah, amazing.
You're welcome.
Thanks, Amanda.
I think we're good. So if you wanted to transition to the next part of the meeting, that would be great. And then we'll follow up with Amanda's contact info and her list of resources to everybody.
Awesome. So just, there is one little surprise Lauren's going to talk about, but does anybody have any announcements or anything they wanted to share with the group? And as I think
the best way to do that would be to raise your hand, and then we'll call on you. So to do that, you would, the little participants icon that's on the bottom part of your page, if you click on that, and then should be a button that says raise hand, and then we can call on you, and you can make an announcement, you can share some resources, we've got a few minutes left. And
then Lauren, do you want to tell them about the surprise while we're waiting for that?
Well, before we do that, Rachel, did you want to tell them about the next meeting? I think we were going to mention that.
Yeah, the next
talk about that.
Sounds like looks like, what was it, 80% said yes. We also wanted to put a poll that said, like, okay, now we're at the end of the meeting, are you sure you want to meet virtually still?
I think they do. You can't, yeah.
Yeah, after Amanda's great conversation, how can we not? But we were also thinking about maybe even doing a happy hour up the road, right?
Yes. If anyone
I can put up a poll on a happy hour.
Awesome.
Okay.
Thank you, Steve. So we were thinking, yeah, happy hour, and next month's meeting, same. Well, you can change your locations. You can be wherever you want. But it's June. Gosh, it's running together, and we're going to have a dietitian speaking. So we're really excited about that. And Lauren. Do you want to tell them a little bit about?
Yeah. The gift?
Yes, the gift.
Are we ready for the gift? Okay. Well, as if Amanda hasn't provided enough for us, as a little departure gift, she's going to provide some mental support, physical too, maybe. I don't know how physical you're going to get with this, but in a closing, she's going to do a little breathing, stretching, sort of an exercise for us for just a few minutes to part. So we hope you will enjoy this. I know we do this. We've done this with our group, and boy, is it a nice way to start or end your day. Thanks.
Oh, that's
Amanda.
awesome. But I do have an attendee that wanted to say something. It's Allegra. So Allegra.
Oh, okay.
Allegra.
Hi, can you hear me?
Yep.
Okay, perfect. Hello, everyone. Yes, I'm Allegra, and this is my first meeting with you all. And I loved it. I loved it even virtually. So I would go to the happy hour to see the full team.
Welcome.
But thank you. I have founded last year the Millennial 50 Plus Ambassadors Club, and we are millennials that are trying to advocate for older adults and services and education. And so I just wanted to share with everyone who's listening, we're looking for presenters to share with the millennial community, how to advocate, what resources are available for older adults. And we're doing it now virtually because we can't meet in person. And so if I have my information on the chat if you'd like or you're interested in that. I also launched a business during the midst of the COVID-19, and that is Let's Connect LLC. And we also we're going to do parties and in-person work, but right now we can only do phone calls because of the virus. And so we are chatting. We are a free service right now because of COVID-19. So we are not going to charge. And we are connecting folks to other resources. So if you would like to be on our resource page on the Let's Connect website, please reach out to me. We would love to have a listing of what our community is doing, and we're also doing like videos and promotions on our social media for other businesses and nonprofits. So that anybody who's interested and who would like to share what they're doing, please just let me know. Thank you.
Thank you.
Allegra, glad you're here.
Welcome to the meetings. And it looks like 67% of people are interested in a happy hour.
Not surprising. Okay, so we'll work on setting that up for everybody.
Like I said, here's a little humor for you. Like I said, there's healthy coping skills and not so healthy coping skills, but we get through the best we can.
Yeah.
All right. So, you can have the option of staying in your seat or standing, whatever you prefer. But what I encourage you to do is find a comfortable position with shoulders down your back. And let's start just by taking a deep inhale through your nose and exhale out through your mouth. One more time. Inhale. Exhale. Okay, let's start with some head rolls. So, start in the direction to the right, and maybe you bring your head up, down, slow. Feel any tension that you have throughout your neck and your shoulders, and keep that breathing going, trying to release that tension. And when you come to the beginning of your head roll, switch directions. Loosening up the muscles of your neck. And when you're ready, come still in the center. And let's do a little bit more of neck stretches, because a lot of us hold our tension and stress in our necks, but also with all of this virtual work that we're doing, we're sitting at the computers maybe more than ever. So bring your right arm out to the side, fingertips pointing down, and then bring your head over to the left, and then tuck your chin And you can feel a stretch in your whole right side of your neck. And just breathe there. Your arm can be down a little bit, right? Like you don't have to be holding it up like you're exercising, but just reaching your fingertips down to the ground, maybe. And breathing. And then roll your head down and bring it to the center. And let's switch sides. So bring the left arm out, fingertips down, reaching towards the ground, and then bring your head over to the right, feeling that stretch, tucking your chin, breathing. And you can bring your head down and then back to the center again, shake out your arms. All right, and then with all the typing that we're doing, maybe bring your right palm up and then bring your hand on your fingertips and just give your wrist a stretch. You can flip it over and kind of do the same thing. And switch sides. And flip it over. All right, and we'll shake out our hands. And then let's just do some, they call them sun salutations, but you can just bring your arms up over your head and then bringing them down to the center and bring them up. Make sure your shoulders are going down your back, bring them up again. And breathing those deep breaths. Okay, all right. So these are actually really good to do in the middle of your day. And you can even get up and kind of, you know, do some marches or do some jumping jacks or something if you feel inclined. But, you know, these type of things can help you have better focus during the day. It can help you have more energy, more motivation, and concentration. So they say that if you get up from your desk and take breaks every couple of hours at least, even if it's just a minute or two, that you get the blood flowing, you clear your mind, and you're just so much more productive. Even if we're saying to ourselves that we're so busy we don't have any time for that, you're actually giving yourself more time. So I encourage you to try to find some time to do that.
I totally agree. We're doing a gratitude circle every day at Arbor Terrace. Our engagement director, Susan Kane's, leading it, and we're doing saying we're grateful and then doing some of these exercises. And I love them, and I feel like I can take on the rest of the day after that. So thank you so much for doing that.
Thanks, Amanda. We really
You're welcome.
are so
Thanks for
your
having
time.
me.
And the extra treat at the end.
Yes.
So thank you so much for joining us virtually here today. I hope that you're all well. I can't wait till we can see each other face to face again. And
a big thank you to Steve for being so helpful in coordinating this for us.
Seriously, the best Oz ever.
You bet. No, we're getting used to doing this. So I'm cutting and pasting the chat, and then I will I'll work with I've got all the emails from the people that are on this call, but I think what we should do, Rachel, if you can share the list for for the group, we could make sure that we get the recording and the chat and Amanda's resources out to everyone. So Amanda, if you shoot over to us the resources that you want to share, we'll get this out in the next day or so.
Great.
Perfect. Thanks again, everybody. We'll see you.
Have a great day.
Yep.
Thanks.
Bye.
Take care of yourself. Bye-bye.
Bye.